Hi, everybody. My name is Kathariya Mokrue, and I'm a member of the Public Education Committee for ADAA. That's the Anxiety and Depression Association of America. Welcome to our webinar, The Persistent Trauma of Systemic Racial Inequity and the Perils of COVID-19. And our co-presenter today is Dr. Mbemba Jabbi. These webinars are presented by the Anxiety and Depression Association of America, which is the leading nonprofit organization in the field of anxiety and depression. Our mission is to improve diagnosis and promote the prevention, treatment, and cure of anxiety, depression, and stress-related disorders through education, like this webinar, practice, and research. Please take advantage of our amazing resources on the website ADAA. That's www.adaa.org. You'll find a great list of treatment providers. Just click on Find a Therapist from the home page, and as well as a free peer-to-peer online support group. And if you have questions after watching the webinar, you can send an email to webinars@adaa.org. You can also support ADAA by making a charitable donation on the website. So let's get started. I'm very happy to introduce our co-presenter today, Dr. Mbemba Jabbi. Mbemba Jabbi is an assistant professor and clinical neuroscientist at the University of Texas at Austin Dell Medical School. He's also part of the Department of Psychiatry. Dr. Jabbi completed his PhD training at the Department of Biological Psychiatry and Graduate School of Behavioral and Cognitive Neuroscience in the Netherlands, University of Groningen. His postdoctoral and research fellowships at the U.S. National Institutes of Mental Health, Bethesda, Maryland. His research at Dell Medical School, UT Austin, focuses on identifying neurobiological abnormalities, underlying mood dysfunctions, and suicidal risk tendencies across the human lifespan. The overarching goal of his research is to identify brain mechanisms that could inform a better understanding of the biological basis for maladaptive mood states and contribute targets for novel treatment and prevention strategies. So welcome, Dr. Jabbi.
Thank you, Dr. Mokrue. It's a pleasure, obviously, to be here and contribute to this discussion with you. And thanks the ADAA for the opportunity to contribute to this discussion.
Thank you for being here. I'm really excited that we're allowed this space to be able to talk about such an important topic.
Yes.
And I remember when we worked together on the blog with the same title for ADAA a couple of months ago now. It was when we sat down together and spoke about it with we were pretty much at a loss for words and how to begin to talk about this topic. Right. And now months later, we have even more examples of such traumas that is so persistent, examples that are so in our faces all over America and the world. So I'm very glad to be able to at least begin some conversations talking about this.
Yes, yes.
Okay, so the way the topic came up in our ADAA Public Education Committee was, as COVID was raging again a couple of months ago, there were discussions on, how do we help our community who are seeking assistance from ADAA, seeking some guidance from ADAA regarding how to get back into living their lives again post-COVID. Some members brought up, well, getting back, re-entry, so to speak, it's going to be very different for people of color versus, kind of the general public who are not part of the communities of color. And, right. And that was certainly in line with, the racial unrests, the police brutality that we've been seeing more and more, the killing of unarmed Black men and women. So there's just a lot to sort through, and communities of color have to consider what this reentry means for them, and
Right.
that is going to be very different from those who are not from the communities of color.
Right.
So what are your thoughts around the topic initially? Was it hard for you to pull all the different examples of what is different, right? What is different for people of color?
Well, like you said, what the COVID pandemic did is kind of expose what has been actually around in the system, and let's just focus on the United States for centuries, right? But because millions, tens of millions of people are home, stuck, socially distant, and at least with some time on their hands to be glued to the screen and get more information out there. So some of these systemic inequities and the repercussions, which obviously are leading to tens of thousands of deaths that are skewed in terms of demographics, meaning that being Black becomes a clearly visible risk factor, being Latino or Native American, which together could be called being Black or brown, becomes a very clear risk factor. So what it does is kind of uncover what has already been there as an ingrained aspect of the system. And be as it may, it's good to kind of shed some light at the professional level. So I'm happy we can talk about how these things connect with our biology and also what could be done about it.
Right. Indeed, it can feel overwhelming to not understand what's happening because it's can take such an emotional toll, being exposed to the range of disparities. And just kind of to touch on the range of inequities and disparities, I mean, we see the stark images, right, of police brutality. But then there are also other disparities that are not easily seen, right? And I just want to pull up the slide here just to highlight some of the items that was noted. I don't know if you can see.
Yes.
Can you see that? Great. Okay. So the range of inequities that we see, and this is also mentioned in the blog post, is the living conditions between people of color and those who are not living these conditions. People of color are disproportionately affected by unhealthy and less than ideal living conditions. We talked about the exposure to violence, disparities in access to quality resources, and that includes mental health care, which is what ADA is trying to mitigate, is to provide more access to mental health care. But we know mental health care is very much underused in communities, people of color, communities of color. But
we
beyond,
just connect back to what you are talking about in terms of access, right?
That's right, access. Also, just fundamental living things that we need to live. So water, clean water, air. You mentioned and pulled some very helpful resources together that this is also something that we don't see day to day. We don't see these things on the news, but it is a disparity that disproportionately affect communities of color. Now we're access to polling, access to getting the votes out, so trying to exercise rights is also what we see some disparities in various parts of the country. Wages, jobs. With COVID-19, we saw that essential jobs are disproportionately being held by people in communities of people of color, talking from grocers to delivery people, nurses, frontline workers who are helping the rest of the world get access to basic needs. They are exposed to our greater exposure to COVID and risks. We've already mentioned police brutality. We also know that communities of color experience broken criminal justice system, often receive harsher sentencing for the same crime, the same charges. And for me, the range sort of covers the gamut of daily hassles to kind of the more drastic images of harm, of violence.
Right. Yes. So to add to that, I think what you just highlight a list of environmental factors, which, for example, if you can go back to the slide again, are just shared environment that everyone is sharing together. But if inequities and disparities are clearly creating a split in, say, living conditions, like you have one group where the neighborhoods are less, less safe, but also poorer and exposed to more pollution. What that does is that the neighborhoods, by definition, are also more challenging. And if that connects to access to less access to, say, health in all its kind, and less access to clean water, that adds another layer of challenge to that environment. And this is really what's impacting Black and brown communities around the country. And if you take that and connect it to, say, wages, but also access to jobs that could allow people to be, out of harm's way during the pandemic, these are all factors that culminate together and exacerbate the impacts of COVID, not to mention about even the exercising of one's right to vote. If you have 10 times more people that have to be on a line somewhere and it's during a pandemic. So statistically, the chance of, people who are in a more accessible polling environment are less exposed. And the list goes on and on.
Absolutely.
So environmental challenges for one community that could also be seen as, when those challenges are taken away, the environmental advantages gets us back to the definition of why there is more impact of the COVID epidemic on one community than the other, because what the environment is allowing us to live better and succeed in life could be translated to become challenges when those access as well as opportunities are not present.
And the sheer task of getting through the day, even just it's hard enough to try to figure out how to make ends meet or how to go about your day, going through the daily hassles of getting to work, right? Even using that as an example, and you have all of these additional dimensions to consider, and that's on a daily basis.
Right. So if you take COVID out of the picture, let's say looking back to 25 years, and this goes back to the time of slavery, hundreds of years ago. But if you just take 25 years, there will already be a cost to living in a more challenging environment because the system is designed that way, which are not independent. In fact, they are cumulative causative reasons for underlying health conditions. So if we take those underlying health conditions that is, more prevalent in the Black and brown community as a result of continuous exposure to environmental challenges, and then that continuous exposure is also leading to another exposure to the presence of an invisible pathogen called COVID, then you have added layers of risk, and obviously the outcome is more infection and disparate number of deaths, and it keeps going on.
We're talking generation after generation after generation of cumulative effects. So not just in the last 20, 30 years, but in generations. Right. And we're just talking about one element here, the environment, right? Not even all the other layers of access to resources, other resources, and wages and jobs, and indeed. So this is why I think when we first talked to one another about this topic, it was just like, where do we begin? It's just so much. Dan, I love that you gave this one very clear example, pulling out the environment piece and how that's just one piece of the pie. And there's just so many other factors there that we haven't started to scratch the surface of.
Indeed.
And I want to just kind of go back to the title of this talk is persistent trauma, right? The trauma of these inequities, this disparity. And as a clinical psychologist, the word trauma has a very specific meaning, right? When you talk about traumatic exposure, we're talking about when you are at risk. It's very specific according to DSM-5. And if you are at risk for you undergo an incident where you nearly lost your life. So in a car accident, when you're assaulted, and there's a very enhanced risk of losing your life. In a wartime, when you're in battle, or in natural disasters where your life may have been lost, you're very close to losing your life. So that's just one very specific criteria, so to speak, of what a traumatic incident is.
Right.
And this might speak to, certainly, if you are speak to like police brutality, if you were shot at, that certainly qualifies as trauma. When we talk about the living conditions and microaggressions, the daily encounters, what do you make of that? Looking at those factors, those incidents as trauma.
Right. Yeah. So this is a great point, and the way you summarize it as a clinical psychologist actually makes it easy for me to connect the dots here as a neuroscientist. So again, getting back to the conceptualization of environment and the challenges instead of the protectiveness on the other side. I think what we define trauma as a measure of how close a call, specific or cumulative and repeated experiences are to being a threat to our survival. And obviously, survival in this case is relative because it could be just some injury, either physical or psychological injury, like a threat that's only imagined. But it could also be that we're going to lose our well-being, our earnings, or even our status through some insult from somebody verbally. That could be injurious to not only the self-esteem, but your standing, and a question of, why do I deserve this? But also physical injury, and they can all be tied to, say, police brutality, but also, situations in terms of getting jailed, or you count them, even in war situations in the extreme. So what the body is kind of doing generally is to allow us to navigate our environment and survive on a daily basis, right? And the brain is the pinnacle of that survival. So when trauma happens or something traumatic happens, the brain is kind of calculating and keeping that in memory again and again. What are the risks to our survival? And if there are systemic inequities whereby, you know, a group of individuals in a community, and in this case, you could even say cumulatively based on how dark their skin color is, are actually perceiving their environment as, you know, more traumatic cumulatively because the challenges they overcome on their daily survival are just, you know, higher than average. Then, you know, just being around itself could be seen as traumatic. And that's what COVID actually kind of translates and, you know, put out there for all of us.
Right. Thank you for reminding us of that. This is, the definition might not be as translatable at first glance, but when you think about the effects on the individuals experiencing who are faced with these incidents, whether it's just one incident as a car accident or the cumulative effects of having to experience shame and guilt and slights, the microaggressions daily. It leads individuals to feel, you know, kind of on edge, hypervigilant, looking to constantly be on guard, feelings, you know, when it does happen, how did this happen, feeling shame, guilt, fearfulness, anger, the emotional toll this takes, and are very, very similar in terms of the parallel paths.
Right. So whether knowing that, you know, you can physically be attacked out there just because of, you know, the hue of your skin, that imagined feeling of threat that's potentially existing, as well as, you know, also the challenges of going through your daily life. And let's say, you know, the perfect example is that the United States is one of the most wealthy countries in the world. But because there is also a perceived unfairness whereby, you know, based on people's average color of their skin or background, for the same effort, the same job, some members of the society are earning more than others. That perceived unfairness in and of itself could culminate to added trauma.
Right.
So instead of thinking, okay, this is the best environment there is in terms of wealth accumulation and standard of living, there is also that perceived unfairness that is going to dampen that effect. So instead of beneficial, it could actually lead to issues in terms of health and psychological trauma. Again.
Right. And I think you're just touching on sort of, again, the range of aggression, so to speak, the racism that people experience. And it can be, and when we talk about microaggression, I'm referring to sort of the more subtle, right? The subtle behaviors, comments that might not be intended to cause harm or cause discomfort or attack, but it does serve to denigrate, right? Communities of people from communities of color, and these happen routinely, several times a day for some people. Are being followed by, you know, in a store, saying, "Oh, you're overthinking it. This is not about your skin color. It's not about you." You know, even just seeing people crossing the street because you're going one way and you're from, you know, person of color. These things are cumulative. Even if so it's taxing, and you can't help but notice those things. And I just want to share an example of something like this that happened recently. My husband and I, he's Black, and we have a biracial daughter. We went on a camping expedition just recently. He's also a police officer. He's been a police officer for almost 20 years. He's also a dietitian, but that's a different story. But he was the only Black person. We're the only minority family that went to this camping site, and we were stopped. He was actually singled out when I was putting my daughter down for sleep for the night. He went to get ready to take a bath, get ready to come back to sleep, but then he wanted to check on his car, and this was around 7 p.m., still dark, and he was called out. One of staff at a hotel that's in front of the campgrounds stopped him and questioned whether or not he belonged there, and this really kind of took him off guard, even though he's experienced, clearly he's experienced all his life, many instances of micro and macroaggression. But here we are going on vacation, having a great time. And so it caught him off guard, and it really shook him up because he was concerned the police was going to be called, and what would that do to, the experience and whatnot. And even though that didn't happen, thank goodness, it could have turned out very differently, but it stuck with him, and it made me very angry to see him go through that. And he is a police officer, he knows exactly how that call was going to go through, if they made that call, but so you can't camp when you're Black. You can't camp, can't run when you're Black. It's just like anything. You can't go bird watching. And it's just all the regular everyday things that people take for granted. You as a person of color, particularly Black or brown, it's not something you can do lightly, right? There's always that threat.
Right. And just getting back to your point again, the kind of that not only imagine but understanding that there is inequity and there is injustice, and one example being on average, Black and brown people are getting less for the same efforts, meaning for doing the same job and exerting the same wear and tear on the body, the returns are less on average, kind of cumulatively leads to an imagined feeling that definitely doesn't help in terms of people, members of the community that's disadvantaged to feel better or even healthy about it, because not only is there a loss of wage comparably, but the efforts are the same, and that adds to that imagined feeling of inequality and obviously racism. But again, you can flip that to the same example of you and your family, your husband being a Black man, and your family paid the same amount for access to that camping, meaning you are going out there with your daughter to have a restful moment and get away from the city and have some fun and be out there in space. You pay the same amount. And what he's getting, and which is systemic, because, God knows, maybe the security guards have a specific instruction that says this is what's defined as suspicious people, right? And he falls under that category. And it wouldn't matter whether he's a police officer, or which he is, or he's a professor, or even, you name it. But paying that same amount, getting in that camp, instead of resting, he is experiencing the same continuous cumulative injurious behavior to his mental and psychological well-being. So it does add up all together. And then it kind of, from a biological point of view, it also, unfortunately, is intergenerational. because what happens to our body and our brain keeps becomes engineered in our biology, and we pass it on.
There was definitely not very, I mean, we had a good time, but it was still not restful. And I think it's something that people don't realize, or maybe the intention when we called the hotel, the story was, oh, the woman who works at the hotel couldn't have meant that. She has good intentions. She's not like that, right? So that's another injury that I think adds to the doubt. Like, am I overthinking this? But it's also very difficult for folks to see or experience a cognitive dissonance. They don't see themselves when they're doling out these microaggressions. People don't always see the intention, right? The intention, it's not to harm, but it does harm. And so there's that layer of like, oh, I'm not racist. How could I be doing, I wouldn't do that. So that was another layer of confusion, right? It creates a confusion. It's like, well, it happened, that's what happened. And whether or not you intended this injury to happen, it did cause harm.
It does, it does. And if we expand this and look at the demographics, that's just one person, your husband being a Black man, but there are millions of Black men, Black boys, and millions of Latino men or Latin boys or Native American or Black and brown in general, but also women. So from the point of paying for the same amenities and going there to enjoy yourself, or just being out in the environment, if the cost of surviving a job, which shouldn't be about survival at all, it's about having fun and staying fit. If the cost of surviving a job or just being in traffic is cumulatively higher for Black and brown men, or anybody who's Black and brown, there is a cost to that, physically and mentally, and it adds up. And if the cost of going out there and doing a job and a livelihood is not providing the same benefit for that same group, and as you can see, there is also this disparity that the browner the skin color of women, the lower their wages on average, although this is not true for any individual, but Black and brown women earn less than anyone else in the workforce in the United States for doing the same jobs. And if those jobs happen to become more disproportionately exposing factors to being infected, it means that community is getting exposed, getting infected more or less.
That's right.
So these are things that are body-brain connected, but again, it comes back to the persistent effects of what we are seeing with
cumulative, intergenerational, historical effects. So I'm going to make you the presenter so you can share your diagram of what happens to our body. And you can talk a little bit about how all of these different experiences, affects the brain. And there we go.
Yeah. So can you see my slide?
I can see your slide.
Okay. Let me try and get to this slide here. So again, this is part of what we discussed, and you already mentioned the psychological aspect of this very helpfully. And I guess what I would do is explain this. Is this slide on full screen or not?
You could click, there we go. Click, there we go.
Okay, yeah. So again, what you see here is, if this is any helpful, is that we have a picture here of a healthy environment. Getting back to our discussion, a healthy environment could be anything out there, but also inside where we live, right? So environment is healthy, and in this case, a group of people at work just having coffee and discussing their morning or day, if this is how environments are ideally like, and then so there is less challenge for us to go there and survive our days, and if we add all of those up cumulatively, our lives. So the brain, which is at the pinnacle of our body's ability to meet our daily challenges or consume the good things in life, then what you get is, a healthy environment is promoting a healthy body and obviously a healthy brain with less cost. Even at the cellular level, there would be healthy cells in the brain. So this is just to show that. But in an unhealthy environment where there is a accumulation of adversity, and again, keeping in mind that this is really transgenerational, it goes all the way back. So let's say for hundreds of years, people have been enslaved, and can go into that, but you know what that means. So there is no accumulation of wealth or freedoms, and again and again and again. So, or the persistent segregation as well as racism going all the way, this all together, polluted environment. This creates an unhealthy body because the cost, not only for the body, but the brain that drives the body. And I'll come to that a little bit in terms of what the brain is, the fit of the brain in this picture, is that there will be that consequences psychologically to stick to our main topic, being members of ADAA, and the context of this webinar. There will be a more prevalent affective disorders, depression, anxiety, and other things. And just to contextualize this, I don't know if we can see here that I'm holding a model of a human brain, which is enlarged and magnified. But again, when I say the pinnacle of survival, the brain enabling us to survive, being at the top of the body, it has what we call cranial nerves. And all of those are going out, to specific senses, which is our sense of taste, our sense of smell, our sense of touch, the motor system. So what the brain does is kind of put all of that together and computerize and say, okay, whatever you are smelling or hearing is good for you. The context, the environment is bad for you. Let's keep that in memory. Next time, avoid it or avoid it now. So if that environment happens to be, say, collective exposure, we can put this in two ways. So police brutality is one, but also just hassle of getting a job and keeping it, or even healthcare, and just trying to escape poverty, including access to good schools, playground, anything. That cost is just cumulatively adding up, and obviously it's not beneficial to the brain from generation to generation. But again, the connection of adversity as far as the brain helps us do this is not different in terms of physical and psychological. So what COVID does is invisible ability, because they are, viruses, we can't see them, they are just tiny, and they spread around in the air and other ways. It has this invisible ability to go and invade our body and destroy our lungs and other organs. So it's injurious. It's a disease that kills us. And how do we manage and let our brain navigate our environment to deal with that is one thing. But out there already, there are also these things that are ingrained in society: police brutality and poverty and segregation and racism. Those are all injurious, not only psychologically, but physically. So if you add the inequity and the fact that part of the population, Black and brown people, have to go out more on to make a living, and then the invisible presence of COVID is obviously, making them become more exposed, this all adds up. And what you end up getting is obviously a magnification or maybe multiplication of the disparities. And again, I put three things here in terms of embodiment, and I can go back to environment and say it's not just outside, but also inside, right? So if you are in a neighborhood where it's less safe and the air is obviously less healthy, but also the drinking water is less clean, that's not just environment outside, it's inside. And if millions, tens of millions of people are glued to the TV because they are trapped inside, socially distanced, and then all we are seeing is, scenes like Ahmaud Arbery, obviously George Floyd, but also the safety of people's bed, tucked in bed, sleeping, as in the case of
Breonna Taylor.
Yeah. What we get is that this is embodied. Like even inside in my bed, I'm not safe anymore. And it can lead to a collective multiplication of the trauma that's already there. And again, when I say embodied, it goes to a larger extent. So what the brain does for somebody who is in their 20s or 30s, they've looked at the mirror several times, like thousands, maybe tens of thousands of times. And anytime they're looking at themselves, they see their skin color and everything that makes them look the way they look as an individual. So that embodiment of your own identity is not independent of how you see other people outside. So the more somebody's skin color looks like you, your brain is coding that in a way that is kind of closer to who you are. So if you see things that are happening to people whose skin color or their looks or whatever you share with humanity, it's more like you. You can help your brain to connect those dots and say this is more of a problem for you because this is looking like you. And that's embodiment. And this adds to the trauma. And then there is what we call conditioning. So as smart beings, as humans, we don't have to know that the only way that fire does is burn us when we touch it. We can be conditioned to avoid that. So you can be conditioned, meaning just one time or by seeing it, your brain will tell you to avoid things or automatically take action to prevent harm again or trauma. And all of these imagined feelings obviously are entrenched in our biology, meaning from trying to avoid pathogens or fighting a flu, or in this case, COVID, or also injurious psychological events that happen like racism, segregation, systemic inequality. They lead to unhealthy bodies, unhealthy brains, even at the cellular level. Although this is not studied well, it's an area that we need to actually look at very closely.
Right. I hear loud and clear that you don't need to directly experience. You can watch. You can see this through vicarious learning, and your brain connects the dots. Right, connects the dots. I'm also. I need to be careful. So I need to be on guard all the time, or be careful, and that's taxing.
Right. It is. So physically feeling something, or psychologically feeling an injury, or imagining it are all more or less translated to one thing. How do we deal with this challenge to survive? And that's what the brain is doing. And the act of, computing that, whether you physically, are brutalized on the street, or feeling that, in traffic, you are unfairly treated and have to pay a fine or even go to jail for something that everyone else around you on the road is doing, they are taxing. And obviously, if we add to this within the context of COVID, there is also this disparate exposure to the invisible pathogen.
Right. And no wonder
just like if being in a neighborhood means that there is closer vicinity to factories that are polluting the air, I am by definition more exposed to those pollutants. Same goes for lack of clean drinking water. I'm going to be more exposed to those pollutants in the water. And that's just all adding up.
It's tremendous. It's overwhelming. Overwhelming. Factors just adds up day by day. Right. So that brings us to the question of, a lot of people watching what's been happening. I'm hearing an echo. Do you hear an echo?
A little bit. Yeah, there is some crack. Yeah.
Okay, let me try taking off. Is that a little bit better?
Let's see. Sounds better, but I'm not sure.
Okay. All right. I'm not sure. That's about all right. See if I could lessen that a little bit. Okay, here we go. All right. I think that happened. Okay, now it's a little bit better now. Okay, so maybe not so much better. Okay, we'll go through it hopefully without having to pause. So all these different factors. For most people, and they're just affected by everything we've just discussed. It's not that there's a sense of anger, a sense of frustration, outrage, helplessness. Just some people report feeling burned out. And what's the point? That's the kind of the emotional toll. And a lot of people have, I certainly see it in my patients. They're reporting more of a sense of helplessness, hopelessness. Patients who are from communities of color, as well as those who are not from communities of color, and certainly, different. They're dealing with different concerns, but it's not uncommon. This is why we're part of the reason why we're doing this webinar, is because people are feeling the emotional toll of seeing, right, the toll and the truth, and more clear all of these disparities that maybe it was nice not to pay attention to for so long, and now it's in our faces, and we don't have to dig very, very deep to see that they're real and they're impactful. And if it's left unchecked, what I find is, it's those mental health consequences are real. We already know that trauma, repeated trauma, can lead to increased depression, anxiety, difficulty sleeping, less motivation. And so I think it's very important that we talk about that, that there is some ways to offset and ways to try to deal and cope with the consequences of the persistent exposure to trauma. So I want to just kind of mention some key elements that I tell my patients, that I talk about when I teach my students who are predominantly from communities of color and talk about feeling helpless and angry, all these things I just my own family, our own reflection and taking steps we are going on to. Just the screen and some of there we go. Can you see my screen?
Yes.
All right, great, thank you. So some of the coping choices, certainly not everything sense or moving, but it's really important. Talk of our emotions.
Yeah, so your voice is cutting a little bit.
Oh. All right. Let's see. There's an echo. Right?
Yeah, it's a crack. Like I hear a crack, but are you hearing that from my end too?
I hear an echo.
Okay.
Right. Not a crack.
Okay. Yeah, well, let's go. I think we are running out of time. Let's see how far we...
So it's important to take and again this could be different. Include anger, sadness, rage, depression. It's the instincts might push emotions and get them to avoid them, temper, hide them. But it's really important to not do that and really allow ourselves to experience and identify, all these different emotions, and give yourself a chance to validate that it makes sense to have these responses. It makes sense to react this way and respond this way to all the injustices, inequalities, the racism that is apparent, that you're exposed to, that you see day in, day out. And sometimes it is okay, and and you can express those feelings. You can cry, you can talk about it, but in some situations it might not be constructive to show or talk about it. So that's something that one has to navigate. For example, it might not be a great idea to express anger at your boss when it's going to make a difference, and it might end up hurting you. So I think, certainly, but it's very important to acknowledge and experience and allow the space to understand why and what is happening in your body, and that it is okay to have these responses to racism, to all these inequalities, inequities, disparities that you see, the experiences that you've witnessed or have gone through yourself. And I think this kind of goes directly to Dr. Jabbi, what you said about, healthy mind, healthy body. It's so important to attend to yourself, to care for yourself, nourish. And this might seem so elementary, so basic, but I think many of us neglect some of the things that can be very helpful to promote a healthy mind and body, and that is attending to self-care. Make sure that you are nourishing your body, eating healthfully, exercising, trying to sleep well, do things that are good for your body, and do it every day. So that means, giving yourself some compassion and treating yourself in a way you would somebody who you love has gone through something tough and you want to nourish and care for them. And so that's something to do every day, because that's going to put your body in a healthier state, in a stronger place to be able to make decisions or to have a better chance of figuring out what to do next. The other piece is, if you don't already have social support, those who value you, those who see you and will lend their time, the space for you to talk about your feelings, your emotions. If you don't have those individuals, it's really important to see to it that you do, because that support is so important to help validate and help create the space you need to make sense and figure out, how to hold all these very difficult emotions in a way that it isn't destructive and hurtful. Other things that are also important to do is to do things that are of value to you. So, have goals that are aligned with what's important to you. If you want to be more productive with reading or writing, make sure you set aside time to get started on those goals and celebrate the micro successes. Highlight every step you've been able to take to do the things that are aligned with your values that are important to you. And that goes to the next item too, is make choices that are consistent with your value. And this will help kind of bring positivity, bring positive feelings to help offset some of the sadness and anxiety and the worry. If you're able to bring and allow yourself to experience these things that are contrary to those negative feelings, you're capable and your life is still valuable, and your life still has a lot of very worthwhile things and it's relationships that you can remind yourself of. And the last point you have on the slide is to try to focus on what you can control and where you can make an impact. And this, we talk about the intergenerational impact of inequities and inequalities. This is a problem that is, has been there since the beginning of time, and so it's not going to go away anytime soon. So being thoughtful about taking stock of what you can do, when it's time to step back, when it's time to go forward, is very important, rather than being reactive to the emotions. It's a good idea to try to be proactive and take stock and really think about what you have in you, what you need to do to feel more grounded in what's important. Because there are so many things that's in a person's life that you can attend to that will help you to not feel overwhelmed by the aspects that are not within your control for the time being. So that was, what I want to kind of leave us time to talk about. Do you have any comments, or do you have anything to add, Dr. Jabbi?
Yeah, so I guess thank you for that, very helpful. I learned a lot from this list of to-do things, and just connecting it to the fact that these are all beneficial, not necessarily psychologically only, but also to our body too. So it's all connected. And again, the conversation of these inequities and how they have been persistent is one thing, but as members of society, we can all do our little bit. And with that, I mean everybody, right?
All communities. Indeed. So, I thank you so much for, and we're kind of getting to the 1 hour mark, and I want to thank you so much for being a part of this conversation. I think it's a good first step, good first conversation, and I hope our those who are tuning in, who are watching the webinar, can walk away with some ideas and how they can think about this in a way that is positive and productive, and how they can deal with this in their lives and understand it better. So again, thank you for your time.
Thank you. Thank you.
I want to just remind our viewers that if you have any questions, you can email it to webinars@adaa.org. And this has been really great. I'm so glad you're able to join us.
Yes, thank you.
That's all. Thank you for tuning in. Take care, everybody.
Thank you.
Bye-bye.